medical professional, when you have a patient in front of you and you've got to then notify them, and I'm sure the reaction must be one of shock initially.
Yeah, but I suppose as a doctor, because I'm used to dealing with it, I also look at oncology and the treatment of cancers in a very similar way to anybody else in medicine and their approach to their speciality. I think when one looks at medicine and its successes and failures, you realize that there are a lot of conditions that you can't cure, and that your treatment is actually aimed at extending life, at maintaining a quality of life. And in oncology, that's exactly the approach that we have. We look at those patients who we can cure, and we honestly and enthusiastically go about trying to cure them. And then we look at the patients who we can't cure, and we ask ourselves in that context, what is the aim of what we're going to do? And I always say to patients, I put the goalposts where I can score, and that success is such a relative thing. I use the analogy of a rugby player who kicks the ball over the goalpost and runs around with his shirt off saying, I scored. And a soccer player, if it goes beneath the goalpost, that is success. Right. So there's the relativity between the whole situation. And so when you're faced with a patient in front of you, they may be devastated, but you as a doctor, if you're realistic, you actually don't feel devastated by it because it is part of what we do.
Do you think the number of patients who have been diagnosed with cancers as a result of better diagnosis, or are we really seeing more people around the world being diagnosed with cancer?
I think better diagnosis is one of the factors. I think better classification and understanding of the disease is another factor. But I do think there are other things that are playing into it that we actually don't fully understand. I think one of the biggest things about cancer is our understanding of the disease and what actually makes it tick, what we classify as cancer. So these are all things that are feeding into the whole process. I mean, there's been times in our history where there's been an explosion of certain types of cancers, and then we've seen wanings of that particular category of cancer. And a typical example is lung cancer, where if you look at the incidence of lung cancers, that increased and increased to a certain stage in our history. And then when we appreciated that it's cigarette smoking that's the causative agent, and fewer people started smoking, or fewer people smoked, we ended up with lower incidence of lung cancers in certain societies. And that those incidents actually resulted in fewer deaths, and the impact on outcomes in that particular disease category was such that more people were actually not diagnosed, and so there were fewer deaths as a result of it.
It's interesting. My studio guest tonight, oncologist Dr. Gregory Landers. We'll be talking about lifestyle, nutrition, environmental factors. The challenge around cancer, if you look at the numbers, at least a quarter of South Africans are personally diagnosed or have a loved one, a family friend or colleague with cancer.